The inspiration for my PhD research came from my grandmother. So in her last moments, she showed characterizing signs of dementia. But being in India and being immersed in a society with very different nomenclature and narratives of these symptoms, doctors perceived these changes as just being a part of old age. And so I saw firsthand the emotional side to caregiving work, the fatigue, the frustrations, the confusions, all the emotions that came with taking care of someone, and especially taking care of someone with dementia. So with my master's orientation to occupational health and safety, I really wanted to explore the occupational stress of paid caregivers from my doctoral work. But before we discuss frontline workers in long-term care, we have to define who these workers are. Slide, please. So I would divide the workers in long-term care into 4 separate categories. And the challenges posed by the work environment, especially in the time of COVID-19, are very different for each class of worker. However, my presentation today will focus on one class of workers and probably the most studied of all the classes, which are personal support workers. And so personal support workers, or PSWs for short, provide anywhere between 70 and 80% of direct care to residents. And PSWs are a group of unregulated healthcare professionals who help with activities of daily living, such as feeding, bathing, and cleaning. PSWs need to be very attentive, of course, to the evolving needs of residents, especially persons with dementia in the middle and late stages who frequently require a high level of care and supervision. Work activities of a PSW are not well defined. And so as a result of that, the PSWs may perform direct care and unprofessional tasks that lie outside their job description. Slide, please. So PSW work involves long and irregular working hours, and most often is part-time or short-term work arrangements. And this work, of course, can be quite labor-intensive with a rather high resident to PSW ratio. Inadequate staffing and heavy workload both create a very difficult work environment for PSWs. And so these workers are predominantly female. In one study in 2015, over half of the participants were immigrants with English as a second language. So of course, here we see this very visible intersection between race, gender, and low socioeconomic status for these workers. And as such, these workers may not speak up against work pressures and poor working conditions, much less so for occupational health and safety risks. In fact, for women in the job between ages 30 and 45, it is actually the most high-risk job just before industrial miners. So this very difficult work environment can, of course, lead to very poor performance, which in many cases have meant inadequate monitoring, missed care, and rushed care of the residents, because there are just never enough hands on deck. Frontline care affords PSWs very little job security and stability, with poor work-related benefits. Additionally, PSWs earn a low wage. So the average PSW wage in Ontario, of course, varies based on type of facility, with wages varying between $14 an hour to $23 an hour. And some PSWs have to work at multiple long-term care facilities to make ends meet and are often not compensated for travel time. So due to both the pay structure and lack of benefits, PSWs are left in a very precarious situation. Next slide, please. So in addition to these challenges, PSWs are facing additional challenges due to COVID-19. So COVID has increased stress among patients, and so the potential for violence situations occurring is also on the rise. And this resistance to care can take either a physical or aggressive form. PSWs have very tightly scheduled days, and so health authority scheduling hasn't quite taken into account traffic time, care time, etc., when scheduling PSW work. Something that's also not so obvious is also that helping support unpaid caregivers is also very much supporting formal caregivers, in the sense that many home care workers have now been called away to do other work like COVID testing, which is requiring people to rely on their unpaid caregivers much more so now. Risk of COVID infection is also a challenge. So given the very congregate nature and resident population services, long-term care facilities now are, of course, at the highest risk of being affected by COVID-19. And if infected, residents are at a very high risk of serious illness, of course. So people in long-term care facilities are apprehensive and may not be coming to work. Along with this, cohorting limits healthcare workers to one facility to prevent spread from help prevent spread of infection. And so these individuals also are having a hard time making ends meet because they're only allowed to work at one location. Because residents are also, of course, they're old and they're frail and they have multiple medical pathologies. This is all alongside possible COVID-19 infection. There's always this implicit understanding amongst PSWs that death is part of the job. But COVID-19, of course, has made the life course of these residents much shorter. And so managing these feelings of grief and loss amongst PSWs when older adults die, of course, is also being overlooked, but is also a challenge for these workers. Since the pandemic, a lot of PSWs and other staff have actually left long-term care for other jobs with higher pay, causing a shortage of workers in a field already short of workers. And so this high turnover and this shortage of staff has created these inconsistencies of care, which of course makes this work environment then even more difficult to work in mid-pandemic. And with all these factors at play, with this increased workload, with these staffing shortages, frontline workers are, of course, are dealing with fatigue and burnout. So under all these pressures, how can we really expect these workers to even perform well? Next slide, please. So there's been a lot of movement and a lot of discussion amongst PSWs and amongst the Ontario Personal Support Worker Association to have this occupation self-regulated. So the fact that PSWs are unregulated now by a licensing body, at least in Ontario, so for example, to have some sort of professional college in place, it poses challenges which are unique amongst this class of employees. So firstly, having some licensing body in place would provide for accountability in the maintenance of high standards. This is not to say that most PSWs are practicing in some substandard fashion. I don't mean to suggest that at all, but by having some sort of body in place, it would be able to better address deficits through self-regulation and continuous quality improvement measures. Currently, PSWs provide a variety of tasks, and these are different amongst different long-term care facilities. Lastly, the creation of a PSW profession would serve to increase salaries for this class of workers. At present, as discussed, PSWs are of course paid a wage which does not provide for appropriate livelihood to be maintained, especially in big cities. And so this would also help address the tendency for casual hiring of PSWs. Additionally, education and training is also very important. And so there should be much more emphasis placed on laddering opportunities within the healthcare workforce by using technology, for example, to support advanced education, perhaps even ongoing opportunities for learning for these workers. And there's a need that has been expressed for standardized education and training programs. More coordination is needed between Public Health Agency of Canada, Health Canada, and long-term care homes to help guide culture and activity in terms of outbreak management and prevention. And because PSWs are the eyes and ears of the long-term care sector, long-term care work understandably can take a sizable toll on these workers in both the short-term and long-term. And so supports are needed to improve the physical and mental health outcomes of these workers. Next slide, please. And finally, with COVID-19, there's of course this increased interest in having this large pool of workers working as PSWs. But this is not an attractive place of work given the ever-evolving circumstances of COVID-19. So Ontario is currently exploring how to make this profession more attractive. Quebec has successfully boosted staffing levels by offering $26 an hour for full-time employment with benefits and pension, as well as $21 an hour for training. Recently, the provincial government in Ontario has announced a spending of $461 million to temporarily boost wages between $2 and $3 an hour, depending on area of work. And this is to be done until March of next year. And this is coming after the pandemic pay back in August, which was a $4 an hour boost in pay. So hazard pay is often associated with male-dominated high-risk work, but here now we're seeing the shift where we're seeing it applied to a very female-dominated occupation. Next slide, please. So these policy issues, of course, are big issues across Canada, and they can't be solved with one action, and the pandemic makes it difficult to address these challenges. Refusing unsafe work, for example, is not an option for these workers. There's this normalization for these workers to put their life at risk in ways that society has deemed essential. Flexibility doesn't quite come with this work either, and frankly, it isn't something that workers really expect. So long-term care workers, as it stands, they do deserve full-time employment with fair compensation, access to benefits, and decent working conditions, as we have seen the consequences of undervaluing their work, which has of course resulted in this exodus of workers and the staffing crisis as we see now. So we cannot let this happen any longer, of course. So these work pressures and these challenges have been known for so long, and they've been put on the back burner for even longer. And it's only now, because of COVID and feeling this immense pressure due to these gaps, that we have now made these become priority issues for both the federal and provincial governments. So I would like to part with the following questions in mind. So first, how can new migrants with healthcare backgrounds be integrated into the healthcare system? How can we increase support and recognition for PSWs, and in this also ensure that they all have access to the necessary supports? And finally, how do we ensure that the physical, the mental, and financial well-being of our frontline heroes is maintained through COVID-19 and after COVID-19? So how do we address the recruitment challenges? How do we address the retention challenges? How do we ensure that these pay raises, these supports, these policies that are now in place are not just placed for the short term, they're not just band-aid solutions, but in fact, they will stay for the long term. So we really need to ensure that we are appreciating and we're taking care of our heroes on the front line, and that we're doing so not only just for the coming months of the pandemic or coming years of the pandemic, but even afterwards as well. So thanks very much.